if you're looking for that information, you might find it out there. And that's that confirmation bias, right? So if I had it in my head that, oh, I must be doing something that's going to cause me cancer, and I'm searching, can this cause cancer? Can that cause cancer? You're going to find that information, and you're not going to find all the stuff that's not put out there because it doesn't support that.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 361. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people, just like you. And today we are doing a question and answer episode. I have two really interesting questions here. If you would like to send me in a question for the show, please send me an email to duffthepsych@gmail.com or go to duffthepsych.com and use the contact form there. Before we get into the show proper, I do have a couple things to talk about, a couple announcements and things like that. So first off, I am a big dummy. All the stuff I'm going to announce, if you follow me on social media and you've been keeping up with stuff this week, feel free to skip forward a little bit. But I'm a big dummy. For some reason, I had it in my mind that the podcast players that you use, like Apple Podcasts or Spotify or what have you, only held the most recent 100 episodes of any given podcast. And I have no idea where the fuck I got that idea, like where that got stuck in my mind. But it's not true. It's that in my podcast host, I had it set to do that. So it was only keeping the most recent 100 episodes. So I simply switched 100 to 0 on my podcast host, and now, voila. If you go to Apple Podcasts or any other podcast player, you can scroll all the way down to episode 1. So if you are newer to the show, or there's an episode that you would like to revisit if you're a seasoned listener, I highly encourage you just to scroll back a couple hundred. We're episode 361 now, so there's a lot of episodes to get through. But scroll back and see if there are any topics that catch your eye. I also used to do a lot of interviews on the show, and so there are many, many good interviews that I did before I stopped doing interviews on the show. So definitely check out the older episodes, and you can do so without having to go to my website. You can just go to your podcast app and scroll a little bit. So yay me for realizing how dumb I was being. The other thing is also related to the show, and that is that I would love some feedback from you guys about the show. The numbers in terms of downloads for the show, and downloads includes people who just stream it, so not just people who download it to their phone, but the numbers have been steadily declining over the past few months, and I've been trying to sort of understand why that might be. I've gotten some feedback from people already that a lot of people have kind of just declined in how much they're listening to podcasts in general, but I just want to make sure that there isn't anything that I'm missing on my side or anything that I could be doing differently. This is just a good time to stop and get some feedback. This is not a woe is me sort of post, or not post. Oh my God, I've been on social media too much. This is not a woe is me announcement or anything like that. Honestly, if the show didn't reach very many people, it would still be okay because I get the personalized feedback from people that I'm able to, help with the question that they send in, or a question they listen to was very helpful to them. That's really, really what makes it worth it. But in terms of things like, I have advertisers and they're like, hey, what's going on with the numbers and things of that sort, just trying to get a better feel for what's going on. So that said, I would love some feedback for you on the show. Things like, how do you feel about the length of the episodes? How do you feel about the format of doing 2 questions per episode? Is there anything that you would like to see from the show that I'm not doing right now? Just open-ended. Anything that you want to give me feedback on, positive, negative, or otherwise, I'm open to it. There's a few ways you can do this. One, I posted about this on social media on Instagram and Facebook. So if you follow me on there, you could find that post and comment there. I also have a survey, like a Google form, that's just one open-ended box that you can type however much you want to in. And I will include the link to that in the show notes, both on the podcast apps as well as on my website at duffthepsych.com/episode 361. So thank you in advance for your feedback, and thank you to everybody who has given me feedback. It's super helpful. And I appreciate you if you are somebody who's listened regularly. Even if you're somebody who drops in and drops out, you mean a lot to me, and I appreciate your attention anytime, an episode is relevant to you. So please don't take this as being ungrateful or anything like that. Just trying to do a bit of a tune-up. So that said, let's go ahead and dive into the questions. Like I said, I have two really interesting questions here. Nothing that's too intense, but some cool stuff to get into. So here's the first one. It reads, "Hi, Dr. Duff. Just over a year ago, I was diagnosed and treated for cancer. I'm lucky to say that my treatment was successful, and I currently have no evidence of disease. However, there is a possibility that my cancer may recur, and I'm having a hard time mentally with this because I think that's inevitable. I'm spending much of my time reading scientific studies about cancer and other people's experiences. Some of what I've read is really scary. At the same time, I feel like I need to know this information in order to protect myself from the possibility of having recurrence in the future. People in my life are concerned that I'm stressing myself out too much by reading this and talking about it with them. My husband is concerned that my reading is keeping my fear ever present in my mind and that my thinking isn't rational. He says that he's given me all the advice he can and that I should stop reading things that exacerbate my fear, but I can't stop. I need to know what I'm up against. I don't know how to live with the idea that this disease may come back in the future. My doctors have tried to reassure me that my prognosis is good and that my recurrence rate is low, but that hasn't helped. I still feel like my life is inevitably going to be cut short and I can't do anything about it. My therapist tells me that I'm going to have to live with my fear. When I've asked, he's given me visualization exercises, but I'm not a visual person, so that doesn't work for me. Any advice? I enjoy listening to your show, and thanks for all that you do." Before I jump into the question and answer this, I did want to say to any therapist, psychologist, anybody that does basically therapy that's listening, please don't do that. You said that you're not a visual person and your therapist is giving you visualization exercises. Ask, talk about these things, before you throw out, okay, well, let's try this. Ask if it's something that you've talked about before, or if it's something that the person has done, or if it's something that they have interest in. How does it sit with you, right? So for instance, the therapist in that situation, rather than being like, oh, visualization's good for that, here, do these exercises, could be like, well, there's a few things I think might be helpful. Have you done any work with visualization before? And open it up, right? And then just talk about it, because that might lead you to say, yeah, I haven't had a lot of success with it. I'm just not a very visual person, and that can help guide things. I'm not sure exactly what the situation is, but it kind of sounds like this was just sort of prescribed to you without a lot of, talk about it. Anyway, that's a little bit of a rant. Thank you for this question. I'm really, really happy to hear that treatment for the cancer was successful and that you've been free and clear since then. That's amazing. However, I know it's also terrifying to consider the possibility that things will not stay that way, that you'll have that recurrence. And this type of issue, what you're going through, is very familiar to me, not personally, but I work with a lot of therapy patients that have chronic illnesses of different types, from multiple sclerosis to spinal cord injuries to severe autoimmune issues to dementia conditions. And I think that what you're doing right now in this stage for yourself is very common. Spending a great deal of your time looking into, what the internet has to say and what the scientific literature has to say about your condition. And probably from there, spiderwebbing out to all sorts of other similar conditions. As I said, this is familiar to me. I've seen a number of people fall down that rabbit hole, and it can very much become a compulsive habit at times, right? It's almost like you don't even think about it. You're just there again. I am going to have to agree with people in your life that have mentioned, that you mentioned about this behavior and reading so much about cancer, right? I'm going to have to agree with some of those people. I don't think that it's helping you. And it could actually, in a roundabout way, be making your chance of the illness returning more significant, right? Because when you are spending so much of your mental energy and so much of your time researching this and looking into it and raising your stress level, you're less likely to take good care of yourself, and your body may have a harder time maintaining good health when you're chronically stressed. So if anything, it might actually be a little counterproductive. I don't say that to make you stress out about that now as another thing, but this is some rationale for trying to adjust the behavior a little bit. I want to be clear too, I don't blame you at all for the urge to continue researching and looking into this, right? This is your body. This is, the most impactful thing probably that's happened to your body, and it's terrifying. So of course, as a human, we have brains that are very well developed, but there's also this primitive side of us that's like, hey, survival, don't rest until you're sure that you're going to survive. And that can come into conflict with sort of the more rational mind. So my advice here is not meant to be criticism. I think that this is a common part of the journey that many people with significant illnesses go through, but it's not helping. The excessive research and what you're doing is not helping you. So I want to, try to provide some insights to maybe move beyond that. So we'll get into that, but really quick, I want to take a break and talk about today's sponsor. All right, this episode is brought to you by MindBloom. Very happy to have MindBloom continue to be a sponsor on the show. If you've been listening for a while, you already know quite a bit about them, and I know several of you have taken the opportunity to get MindBloom, so that's awesome. Anxiety and depression can be tricky. There's not always a very clear, quick fix for it, whether you're finding a new therapist, starting an additional medication, different exercise routine, better diet. Sometimes none of that does the trick, and what you need is a way to unlock your brain, to give you a new way of thinking about and seeing the world. And for some people, that can be guided ketamine therapy from MindBloom. So MindBloom is the leader in at-home ketamine therapy. They have safely helped thousands of people overcome their anxiety and depression. Ketamine is amazing because it works very quickly, and it doesn't tend to have unpleasant side effects like you might have from traditional antidepressants. And unlike talk therapy, it doesn't take a long time for it to make an impact. In a study of over 1,200 MindBloom clients, 89% of them reported improvements in their anxiety and depression after only 2 sessions, which is an amazing tool. So right now, MindBloom is offering you guys, the Hardcore Self-Help Podcast listeners, $100 off your first 6-session program when you sign up at mindbloom.com/Duff. And importantly, you have to use the promo code Duff. So take that first step, break free from your anxiety and depression with MindBloom, mindbloom.com/Duff, and use the promo code Duff. Okay, so jumping back into the question here and trying to help out a little bit. There's a statement that you made several times in your question that I do need to push back on a little bit. You said, I feel like I need to know this information in order to protect myself. And you also said something to the effect of, I need to know what I'm up against. To me, this sounds a little bit like a rationalization and an attempt to gain some control over the situation that you don't feel a lot of control over. So I think that what you need to think about is, how is looking at people's stories online or knowing the precise odds of recurrence going to help you avoid it happening to you again? I just don't think it's fully logical there. And again, this isn't a dig on you, but I think it's important to point these things out because your brain wants you to think that what you're doing is useful. I don't know that it is beyond a certain extent. There's a threshold there where, some of the things that you're looking into could be important, but beyond that, you are maybe torturing yourself a little bit or having that counterproductive situation I was talking about. Rather than visualizations, maybe what you need to work on with your therapist and with yourself is challenging your thinking and modifying your behavior more. So one great question to ask yourself is, even if I found the answer that I'm looking for or the information that I'm looking for, would that change anything about what I'm doing? Right? So even if I found what I'm looking for, would that change anything? I'll share a little bit of an example from my own work, and I can't be too personal here, but one person with MS, with multiple sclerosis that I work with, they had a really hard time after they got their initial diagnosis and started treatment. They were on Reddit, they were on message boards, they were looking at academic journals, they were talking to the neurologist, they were talking to other medical professionals they knew from their family and things like that, and doing very much what you're doing here. And I tend to think of this as sort of like a checking behavior, something that's compulsive in nature. This is not a form of OCD, but there are some similarities there where you have this internal tension and anxiety due to the lack of knowledge, right? You don't know everything yet. There could be something that you're missing. You need to figure out what that is out there, and you have this tension. And so it feels like if you just search a little bit more, if you keep abreast of things, that's going to help you feel better. But even if it does, that relief is temporary because it hasn't worked yet, right? You've been looking this whole time. You've been continuing to check, and you're still feeling very stressed out about this, and you're still feeling like recurrence is inevitable in the future. So it's important to point out that your attempts to resolve your own anxiety are not working. At least this form of that relief is not actually helping. So for the person that I'm talking about that has MS, they were already working out frequently. They were on the best medication that, they could have available to them. They were in close contact with their neurologist. In other words, they were doing everything they could, but that didn't stop that behavior we're talking about here. So yeah, this is that question that I mentioned as an important one to start asking. This is what we talked about together in therapy. Even if you find some information that you weren't aware of, even if, say, this symptom is a sign of recurrence, or this is a sign of progressive instead of relapsing, remitting MS, what does that actually mean? Would that actually change anything in practice? Would that change anything that you're doing? And the answer in that person's case was no. And that's something that really helped kind of pull back. Like, okay, just logically, what is this extra information going to change? Nothing. Already doing all the right stuff, right? That doesn't mean that you can't stay aware and stay abreast of new developments in the field having to do with your particular issue and the cancer. But that's not what's happening right now, right? What's happening right now is that checking behavior, and it's gotten a bit out of hand because it's hurting you emotionally. Now, the other thing to watch out for when you are doing this sort of thing is confirmation bias. When you're searching from a place of fear, you're much more likely to filter the information you find in a way that supports the fear you already have. So you have this hypothesis that is your cancer will come back and steal your life back away from you, right? And so confirmation bias means that when you're searching from a place of having that fearful hypothesis, you're going to filter out information that supports that, and you're not even going to see the stuff that does not support that. It's very selective, right? So I'm looking around me right now, and I have sparkling water in front of me, right? So let's see. Sparkling water associated with cancer risk. There we go. First thing highlighted at the top. Some sparkling waters have a group of artificial chemicals called PFAs that have been linked to health problems such as cancer and thyroid hormone disruption, right? Literally, I picked the first thing that was in front of me as I was looking around. If you're looking for that information, you might find it out there. And that's that confirmation bias, right? So if I had it in my head that, oh, I must be doing something that's going to cause me cancer, and I'm searching, can this cause cancer? Can that cause cancer? You're going to find that information, and you're not going to find all the stuff that's not put out there because it doesn't support that, right? It's also a problem in science, right? Science itself, like scientific literature, has a problem with, I forget what they call the bias. There's a term for it, but essentially journals want to publish studies that have significant findings, but findings that are not significant are very important as well, right? So say I tested 1 million different sparkling waters and I find that there's no link to cancer, and that's what I want to put out. That might be less interesting to a journal than one that has a more flashy sort of result, like, hey, yeah, we need to watch out for this thing. So, even though you're finding information that may be from good sources, maybe not, searching from that place of fear is going to cause that confirmation bias to be more prevalent. So let's talk about what we can do about this. How can you actually start changing this behavior? First off, the cognitive work. We talked about asking yourself that question of, does this make any difference? But you can also challenge some of your thinking patterns and fears here. For example, you stated that if your illness were to return, your life would be taken away from you, and there's nothing you could do about it, right? You said, like, if it were to come back, I feel like it's going to come back, and there's nothing I can do about it. Is that true? I see some evidence that may not be true. Like, you've already beaten cancer once, right? A horrible thing took hold of you, and you got appropriate treatment, and you kicked its ass. It's not there anymore. So that means that you did exert some control over that. And even if it were to return again, it doesn't mean you're out of luck. Some people beat multiple rounds of cancer. It's not the end necessarily. So you need to challenge that. And you need to also challenge that assumption that finding more information will help you avoid the cancer from returning? What is more information going to do for you, unless there's some sort of breakthrough, which I'm assuming you would find either way? So part of this is just a behavioral loop. You have the habit of checking over and over and over for new insights about your cancer or stories, and you need to break that loop. You need to get yourself out of the habit. So some of this is just about changing the behavior itself rather than trying to rationalize your way into stopping. In other words, you maybe need some boundaries, right? Need some boundaries for yourself so you can stop checking on this so much. You don't need to stop feeling what you feel, but you need to get used to living with that uncertainty rather than engaging in behaviors to reduce that internal tension, because that's not going to work. So that's kind of pulling it back to the compulsive element that I talked about, right? So thinking of it from an anxiety perspective, you need to get used to living with that uncertainty and that anxiety, because that's going to make it get less severe for you. What you're doing right now is you're trying to escape that anxiety by engaging in this checking behavior of going online and looking for more information. So you're not really letting yourself build a tolerance to that anxiety. You're trying to escape it through this checking behavior. So by removing that checking behavior, the anxiety itself is going to gradually decrease as you sort of acclimate to it. But it does take practice. It's going to take some time, and it's going to take some, attempts at controlling that behavior. I think that having your therapist check in with you regularly and maybe having them develop some behavioral goals with you. So for instance, working your way to a place where you're not checking as much. So, putting a time limit on how much you're allowed to go online and look, restricting your access to certain types of websites, right? Like maybe you don't need to be on Reddit or these areas where you're looking at personal accounts rather than academic literature or scientific literature. Having some goals like that you work through with your therapist can be good. And then, of course, trying to stop your thoughts is not very possible. So instead of trying to say, okay, I need to stop thinking about this, you might also want to think about, where can you put your thoughts? Can you shift your focus elsewhere? I mean, let's not forget, you beat cancer, right? Right now, you don't have, a significant amount of cancer in your body. I say a significant amount because our bodies are constantly killing cancer everywhere to a very, very small extent, right? But you don't have that full-blown illness. And that's fucking amazing. That's incredible. What does that allow you to do? What does it allow you to do that you would not be able to do if your illness was still taking hold and running your life? What can you do now that you are in remission? Put your focus on the opportunity that you have, your passions, your values. If you don't know what they are, maybe now's a good time to start clarifying those. If you can't stop obsessing about the cancer issue, which is totally understandable, you can at least make those fears compete for mental real estate with the other interests of yours. So that's kind of the main advice that I have. I do see here that one thing that's happening is it's starting to get in the way of your relationships. You talked about with your spouse, you talked about with family and friends a little bit, and we don't want that. So one other resource you may look into is support groups for cancer survivors or for people with chronic illness in general. I think that could possibly be a very good outlet for you to share your fears, your uncertainties, annoyances, everything else in an open way with people that actually get it and understand, rather than taking this to the people that you normally take it to and running the risk of deteriorating the relationship in that way. It doesn't mean you can't share things with your husband, but what it does mean is that maybe taking some of the burden of that off of him and putting it onto people who are actually ones who can understand, because he can't, unless he's been through cancer too, but it doesn't sound like it. So, he wants to be there and be supportive, but he can't really help with this aspect of things in the way that other people might be able to who have been there. So think about that. And that's basically what I have for you in terms of advice. I think you find yourself in a place that many people do find themselves in, but with some changes, you can enjoy your life more. So good luck to you, and I really, really hope this helps. All right, so on to question 2. This one will be a little bit quicker. A very interesting one. It reads, "Hello, thank you for all you do. I have a question that I thought would be useful right now, as it seems to be a popular topic. I'm figuring you've probably heard about these weight loss drugs gaining popularity right now, such as Ozempic, Wegovy, etc. People, especially women, are losing a ton of life-changing weight with these meds and keeping it off. As someone who has struggled with weight loss, I'm intrigued by them. However, the part I'm curious about is that all the reviews I see say that it has fixed the psychological addiction of food. People taking the meds say that commercials for food no longer attract them, and they just no longer think about food at all. In fact, they forget to eat. How is it possible for a weight loss drug to change people psychologically? Could there be negative psychological problems to no longer having an attraction to food? Thanks for reading and considering my question. Yeah, so you're right. This is a popular topic, a very interesting question, and actually super relevant because I do have a therapy patient that just started Ozempic and has been having some trouble with it. So let's start by talking about what these medications are in the first place. Ozempic and Wegovy are brand names for a medication called semaglutide. And this is a medication that's injectable and is designed to help control high blood sugar in people with type 2 diabetes. It can also be used to help people with type 2 diabetes lower their cardiovascular risk. And these medications are unique because, I guess it's just one medication, different brand names, but it's not insulin-based. Instead, it helps your pancreas produce more insulin when blood sugar is high, right? So it's not giving you insulin, but it's helping your pancreas produce more when your blood sugar is high to help regulate that. And then the other thing that it does is it also slows the food leaving your stomach. In addition to those effects, it also impacts what's called the GLP-1 receptor. And this is involved in regulating appetite. So when drugs bind to this receptor, they release hormones that signal to the brain that you're full. So you actually have the perception of being full, which can help you eat less and feel more satiated, more full after smaller meals. So rather than something like a lap band surgery or gastric bypass or something like that, where you're actually creating a smaller space for food to live in, you're slowing down the movement of food through your stomach and then also basically tricking your brain into thinking that it is more full than you are. Or at least, that's kind of a weird thing to say, more full than you are. It's making you feel more full by eating the same amount of food, I should say. And so you can probably see how this would be attractive to people who are trying to lose weight and people that are prone to overeating. The issue with the person that I work with, I was talking about, is that their diabetes, they do have type 2 diabetes, but it's not the result of overeating. They are not overweight. And in fact, they sometimes have trouble getting enough calories in the first place. It's just that their blood sugar is just wildly all over the place, very volatile. They have to wear a monitor for it. And so, their issue has been sometimes not being able to get enough food or not being motivated to eat when they do need to eat more, actually. So that's the basics of how the medication works, right? So it slows down the movement of food. It helps your pancreas produce more insulin when your blood sugar is high. And then it tricks your brain through that GLP-1 receptor into feeling more full and more satiated. Very useful. It's an amazing option for the treatment of diabetes and for weight loss, but it's not without its risks. So make sure you talk to your doctor about risk factors. I know some people have been having a hard time with the way that it impacts their digestion, kind of some secondary effects for that slowing of the food going through your stomach, things of that sort. So it's important to make sure that you have, a team working on this and you have all your bases covered. But now what about the psychological part? You mentioned that people have claimed to feel, less burdened by the psychological addiction to food. And you're wondering, how can that be? Well, part of it is what I already mentioned about the mechanism of action, right? So due to the receptors that it binds to, it makes your brain think that you're full when you otherwise wouldn't feel that way. And so for many people, that's sort of an automatic win. When you feel full, you don't crave food as much and it doesn't look as good. I know for me, I don't have these types of issues, but if I do overeat, my wife says I get weird full. And if I get weird full, then I'm like, don't fucking talk to me about food. I don't even want to look at it. I don't want to think about it. Don't ask me about dinner later. Just nope, And so for a lot of people, maybe they're not weird full like me, but when they feel full, they don't have that same sort of drive to, want to look at food and to, think about their next meal and seek out snacks and things of that sort. Aside from that, though, the medications can actually change people's psychological relationship with food because it alters the way that the brain processes reward signals. So I've actually looked into this a little bit, and there are several scientific studies that have shown that GLP-1 receptor agonists, so like Ozempic, basically agonist means that they increase the functioning of a receptor, so they bind to it and increase the production of whatever it produces. So these GLP-1 agonists actually lead to lower levels of dopamine in a part of the brain called the nucleus accumbens. And I know this is a lot of psychobabble, but basically, because it binds to these receptors, it lowers the level of the molecule your brain uses for reward. In that part of the brain, the nucleus accumbens is part of the brain's reward system. So therefore, not only do people feel less hungry, but they also feel less reward for eating things like high fat or sugary foods. And, dopamine is that thing that makes you feel good in response to doing something, and that makes you do that thing more. So classic example would be like going to Vegas and playing the slot machine, right? You play the slot machine and you win a little bit, get a big old hit of dopamine, and that rewards you for that activity. So through the theory of reinforcement, you're going to do that more. That's called operant conditioning. So, there's a less built-in reward system for eating when you're on this medication because, you can take it and eat, but you're not going to get that same sort of dopamine hit that you would get otherwise. So that's one of the reasons why people might have that change in their psychological relationship with food. The last thing is, changing behavior is often the way to change people's thought process and feelings as well. Changing behavior first leads to those downstream impacts. So getting out of the habit of overeating or eating foods that are problematic for you is something that can be very difficult. But with help, like with medications like this, you can break that cycle and you can build healthier habits. And through repetition and getting used to that, you sort of build a new groove and they're more internalized over time. So you actually change your automatic behaviors. So, I think that there's a combination of factors at play. These GLP-1 agonist medications like Ozempic can definitely change someone's relationship to food and the way that their brain responds to it. Now, the last thing to address in your question is whether there could be potential negative side effects psychologically to not being as attracted to food. I would say it's possible, but not necessarily a major concern for most people. One significant thing to watch out for is for people that have disordered eating behaviors, people who tend to restrict anyway, or people who are prone to undereating for whatever reason. Maybe they have sensitivities, texture-based things, people who are on the spectrum, for instance, any number of things. If it causes people to tend to undereat, these medications may be a little bit risky for actually being undernourished, and that could be dangerous. So, like I said, talk to your doctor about it. Food is also tied to social activity. It's tied to culture. It's tied to emotional comfort. So if somebody finds that they are totally disconnected from food where it used to be an important part of their life, they may need to change their interests a little bit in the ways that they interact with others. Like as a different example, imagine that you used to love rock and metal music, and that is like your community. Those are your people. You go to shows, maybe even play music, and that's your thing. But along the road, you got really significant tinnitus, so the ringing in your ears or sounds in your ears that make it really, really difficult to listen to and participate in the same sort of music. So you kind of love, or you lose the love rather, that you once had for that type of music. And so in order to get that social need met, you need to adapt the way that you enjoy social gatherings. Maybe they don't involve music as a central part anymore. And that's hard to do, but it is possible. So, that's one thing that could happen in the food realm, right? If you're just a foodie and now you're finding that you just aren't interested in food, well, that could cause some alienation from people that you associate with, or just changes in lifestyle that you need to consider. But I think it's important not to overinterpret here. I think that, it's not like most people are fundamentally changed with regard to their attraction to food. It's less about being anti-food and more about alleviating those strong drives that are impossible to hold back and those cravings that previously caused issues. So it's more of a lack of problem than it is a different problem. You're not necessarily trading one problem for another in most cases. So I hope that's helpful. I am not, a gastroenterologist or I don't know what other type of doctor would be, one that manages this sort of medication, endocrinologist, whatever. But, from the psychological perspective, hopefully this helps you understand how this could impact someone's thinking about food. So that's it, guys. That has been the episode. It is episode 361 of the Hardcore Self-Help Podcast. Please don't forget to send me some feedback, either, on social media or through the form that I'm going to put into the show notes. I appreciate you. Take great care of yourself, and I will see you for the next episode.